didn't have that little video, unfortunately, of our president talking to this person who talked about a 95-year-old grandmother who needed a pacemaker. And the first doctor said, no, I think you're too old. You know, you don't meet the criteria that they tell us about. And she went to another doctor and says, hey, you're vital. You can do it. Put a pacemaker in. 5 years later, she's up and running and enjoying life. And so the lady asks him, she says, well, President, are there any exceptions? And he says, well, we have to look at the whole economy and make decisions. It might be better that she got the pain pill. So everybody, and let me quote this, what they think about us. Interesting comment. It says here, seniors, and this is from, once again, this is from the President's office, seniors should be more accepting of the conditions that come with age instead of seeking to treat them. Okay. So if you think they don't have their eyes on you of where they're going to cut their costs, look again. He's right. $500 billion out of Medicare, $200 billion out of, what's the name of that program? Yeah. So what we're looking at here is cost cutting. They are not after giving us quality of care. Right now, we have the best medical system in the world. Why break the system for less than 6% of the population? We were talking about numbers, and maybe the mathematician can help me out. I looked in the Webster's Dictionary, and they said $1 trillion in the U.S. is 1 followed by 12 zeros. In England, it's 1 followed by 18 zeros. I think they have a lot more experience with money than us. However, if you had $1 billion, which isn't $1 trillion to spend, if you spent $1 million per day since Jesus Christ walked on this earth over 2,400 years ago, 300 years ago, you wouldn't have gotten to $1 billion. That's a lot of money. So what's a couple of trillion, they say? Why don't we fix the good, keep the good, sorry, and fix the bad? Why replace the best system with a system that will cost you more and give you less? Any solution that we have has to have the following elements: financial responsibility, a choice of your own physician. The care has to be individually tailored to you, not a manila one-size-fits-all. And also, we have to limit medical liability. I know you haven't seen all the cost savings go down to you yet, but you've seen the amount of good doctors that have been attracted here, like Dr. Greco. There are states like Alabama where people will not touch it because it is a place where people think they're going to hit the jackpot by suing. Let's look at some changes. First, let's look at a little bit of historical perspective. During World War II, price and wage controls were put in place by President Roosevelt. It paid for common illnesses and medications, not just catastrophic events or accidents. the original concept of insurance. So if you change the concept, you can change the problem. Think about car insurance. You can get very competitive rates on car insurance. Why? If you go to fill up your gas tank, can you give the guy $5 and say, that's my copay? How about a tune-up? $6, it's my copay. How about if your transmission drops out? Can you say, hey, here's $20, that's my copay? No, you can't. When did health care become an intrinsic right and not transportation or food? My car broke down about 3 months ago, brand new car. I had to hitch a ride to the office. I hitched a ride from the office to the hospital, from the hospital back to my office, and then back home. Without the car, I couldn't earn a living to buy food, to buy medication, or to put a cover over my house, over my head. Where in the Constitution, as I said, is it a guaranteed right? It is not the government that teaches, that is responsible for how you and I eat, smoke, drink, exercise, or sleep. It's yours, and if you don't take it, the government is standing there ready to take it from you. It's the church and social societies, not the state, that built Mother Frances's, the Baptist hospitals, the Jewish hospitals, the Shriners hospitals, and even the City of Hope, and our very own homegrown MD Anderson, world famous for cancer care. That's who will take better care of the uninsured, the homeless, the hungry, the orphans, the widows, and the poor and the infirm, not the government. The government has given us great examples. The VA hospitals and clinics with restrictions, long waits, and frustrations. And Medicare, 1965 it was started. The government wasn't going to touch it. They were going to just supervise. Will you believe that? There are now 46 trillion unfunded debt. May I suggest that we are a country of free market? We are a country of capitalism, not socialism, not communism. I suggest that we allow the free market to control the costs. I ask, do you go to Walmart because of the extremely high costs and the extremely high quality, or do you go there because they have costs that are low and quality that you need? I say remove the state and the federal government mandates that say what insurance companies must cover. Take the example of cable TV. I want to watch 4 channels, but I have to buy 60 or 100 or 1,000 channels I don't want to watch. I heard a woman who was just livid. She said, why do I have to pay for prostate examinations? You know? So, you know, other sides, why do I have to pay for deliveries? You know, abortions. I mean, it goes on and on, but the state says, this is the package that you have to give. And we don't need that.